Welcome to Drug Use, Chapter 8. There are several reasons why people use drugs, and we will take a look at some of the including reasons, which are obtaining pleasure, joy, and euphoria, meeting social expectations, peer pressure. Some people use drugs to escape stress, anxiety, and tension, avoiding pain, and achieving an altered state of consciousness. Whether legal or illegal, psychoactive drugs alter one's consciousness, emotions, and thoughts by affecting the brain's communication network. You may remember from Module 3 that the nervous system communicates by using chemical messengers called neurotransmitters. You can think of neurotransmitters as acting like chemical keys that open or close chemical locks on neighboring neurons. Many drugs act by opening and closing chemical locks, which in turn results in increased or decreased neural activity. The definition of addiction is a person who has developed a behavioral pattern of drug use that is marked by an overwhelming and compulsive desire to obtain and use the drug. Even after stopping, the person has a strong tendency to relapse and begin using the drug again. Tolerance is a person who uses a drug repeatedly over a period of time. The original dose of the drug no longer produces the same desired effect, so that a person must take increasingly larger doses of the drug to achieve the same effect. It is after treatment of rehabilitation that someone is at high risk for overdosing when they go back to using that drug in a relapse situation. They will use that same larger dose, believing that they need that much to have the desired effect, when in reality their tolerance level has significantly decreased. Therefore, using that same large dose that they did prior to rehab causes a drug overdose. Dependency refers to a change in the nervous system, so that a person now needs to take the drug to prevent the occurrence of painful withdrawal symptoms. Withdrawal symptoms are painful physical and psychological symptoms that occur after a drug-dependent person stops using the drug. Most recently, national statistics show that almost 20 million Americans spend over $62 billion on illegal drugs each year. Drug treatment programs are more cost-effective than imprisonment, and many health professionals recommend reducing illegal drug use by spending more on drug education, counseling, and treatment. Drugs affect the central nervous system. As mentioned in the previous slide, drugs affect neurotransmitter chemical keys that search for and then either open or close chemical locks to either excite or inhibit neighboring neurons, organs, or muscles. Some drugs produce their effects by mimicking the way that neurotransmitters work. Some drugs block reuptake, and drugs affect the brain's reward pleasure center almost the same as when activated. It can be activated the same way when one eats food, has sex, and does other pleasurable activities. Amphetamines act as stimulants. This includes cocaine, amphetamines, caffeine, and nicotine. It increases activity of the central nervous system and results in a heightened alertness, arousal, euphoria, and decreased appetite and fatigue. In the 1960s, they were heavily prescribed to treat a wide range of problems, including fatigue, depression, and being overweight. However, in 1971, the FDA outlawed the prescription of amphetamines for everything except attention deficit hyperactivity disorder and narcolepsy. And this was because they are highly addictive. Following a drug war on cocaine, in the late 1980s, there was a dramatic increase of a form of amphetamine called methamphetamine. It is manufactured in illegal home laboratories. In many countries, use of or possession of methamphetamines is illegal. Use is still spreading worldwide. Methamphetamine is close to amphetamine in both chemical makeup and its physical and psychological effects. It can be smoked or snorted, produces almost an instant high, causes marked increase in blood pressure and heart rate, and it produces feelings of enhanced mood, alertness, and energy. Amphetamines affect the nervous system. The important thing to remember is that it increases the release of dopamine and also blocks reuptake. The dangers of amphetamines are periods of restless activity and performing repetitive behaviors. Later, euphoria is replaced with depression, agitation, insomnia, and development of true paranoid feelings. Long-term risks include stroke, liver damage, memory loss, and extreme weight loss. Next, we will take a closer look at cocaine. It is a drug derived from the cocoa leaves. Cocaine can be sniffed or snorted. It's absorbed by many of the body's membranes. Concentrated cocaine is called crack. Effects are very similar to amphetamines. High doses can produce anxiety, emotional instability, and suspiciousness. Cocaine also affects the nervous system. It blocks reuptake of dopamine. It excites dopamine receptors to produce pleasure, euphoria, and glutamate to produce cravings for more drug. Its increased physiological and psychological arousal. It can be used for a local anesthetic when applied to external areas of the body. And Americans spend $35 billion on cocaine every year. Next, we will look at the dangers of cocaine abuse. In moderate doses, it's a short-acting high, 10 to 30 minutes, and includes bursts of energy, arousal, and alertness. In heavy doses, it results in serious physical and psychological problems, which may include hallucinations and feelings of bugs crawling under the skin, as well as addiction. Physical problems resulting from cocaine abuse are a lack of appetite, headaches, insomnia, irritability, heart attacks, strokes, and seizures, damage to the cartilage of the nose, HIV risk, and respiratory failure leads to sudden death, and it can result even in very low doses. Next, we will take a look at nicotine. In the United States, over 70 million people use tobacco products. 2 million teens begin using cigarettes every year. It's a stimulant that triggers the brain's reward pleasure system to produce good feelings. In low doses, it improves attention, concentration, and short-term memory. Regular use causes addiction and dependency, which can lead to withdrawal. Nicotine also affects the nervous system, stimulating the production of dopamine. It also stops other controlling cells from turning off the pleasure area. Some of the dangers of nicotine are that it is very addicting, and over 400,000 American smokers die each year from lung and heart problems. It causes sexual problems, including impotency. Withdrawal symptoms range in severity and include nervousness, irritability, difficulty in concentrating, sleep disturbances, and strong cravings. Next, we will take a look at opium, morphine, and heroin. These are opiates. Opiates are classified as narcotics. About 136,000 Americans use heroin. Opiates produce three primary effects. They act as an analgesic, which is a pain reduction. Opiate euphoria, it's a state between waking and sleeping. And constipation. The brain also produces morphine-like chemicals called endorphins. These are naturally occurring during strenuous exercise, high excitement, and orgasm. Some of the dangers of opiate abuse is that the brain will produce less of its own endorphins, and it relies on outside opiates. The person becomes addicted, and withdrawal symptoms include hot and cold flashes, sweating, muscle tremors, and stomach cramps. Overdose results in depressed neural control for breathing and death from respiratory failure. Designer drugs are manufactured or synthetic drugs that are designed to resemble already existing illegal psychoactive drugs and produce or mimic their psychoactive effects. An example of designer drugs are MDMA and ecstasy. It resembles both a hallucinogen and an amphetamine. Designer drugs heighten sensations, give a euphoric rush, raise body temperature, and creates feelings of warmth and empathy. Causes large amounts of dopamine and serotonin to be released, and afterwards users may feel depressed and have attention memory deficits. It also may cause brain damage. Next, we will look at marijuana, its use and effects. It's the most widely used illegal drug. When medical marijuana is used, it can be effective in treating nausea and vomiting associated with chemotherapy, appetite loss in AIDS patients, eye disease such as glaucoma, muscle spasticity in patients with multiple sclerosis, and some forms of pain. It tends to have a gateway effect to other drugs, and it says that using marijuana leads young people to try harder drugs. That would be the gateway effect. Marijuana is a psychoactive drug whose primary active ingredient is THC. THC is rapidly absorbed by the lungs while smoking. Depending on the user's state of mind, marijuana can either heighten or distort pleasant or unpleasant experiences, moods, or feelings. THC receptors are located throughout the brain, including the hippocampus, cerebral cortex, limbic system, cerebellum, and basal ganglia. It has recently been discovered that the brain itself makes a chemical similar to THC called anandamide, and when it's fed to mice in a high-fat diet, it increases levels of the anandamide in their liver. This indicates that anandamide plays a role in the development of obesity, at least in rodents. The dangers of marijuana is that it can cause temporary changes in cognitive functioning. It can temporarily decrease serotonin of various hormones and effectiveness of the immune system. It also can cause respiratory problems like bronchitis and asthma, and in high doses may cause toxic psychosis, including delusions, paranoia, and feelings of terror.